3 years ago, a teenage student died in Daegu after being turned away by multiple emergency rooms despite a serious head injury. The case became a symbol of Korea's so-called runaround problem. Now, police have referred 2 doctors from that time to prosecutors on charges of violating the emergency medical law.
In 2023, a teenage girl fell from a building in Daegu and sustained a brain injury. Paramedics contacted 8 hospitals for 2 hours asking them to accept the patient but were refused, and the student eventually died. At the time, the hospitals cited reasons such as having no neurosurgery staff or being unable to provide psychiatric care. Police investigating the case recently referred 2 doctors who were working in the ER at the time to prosecutors on charges of violating the emergency medical law. It came 3 years after the investigation began. After reviewing whether beds were available and other patient conditions, police concluded they had refused the patient without justifiable grounds. The outcome of related administrative lawsuits was also a key factor. The government suspended subsidies to some hospitals that refused the patient, and in lawsuits filed by the hospitals, the court ruled the subsidy suspensions for 2 hospitals were justified. The court said the hospitals should have first examined the patient to determine whether it was an emergency and then take appropriate measures based on that assessment.
외상 처치라던가 그걸 우선 요청을 했는데도 그 외상 처치에 대해서 확인을 하셨어야 되잖아요.
The hospital said they will not respond separately because the police findings concern individual doctors. As the government pushes various measures to prevent emergency room runarounds, actual criminal punishment of medical staff would likely have significant repercussions.